Hello, I'm Dr. Silva, and today I'd like to discuss a complex yet often overlooked condition called Craniocervical Instability, or CCI. For many, this condition can be life-altering, affecting everything from physical function, pain, to cognitive function and overall quality of life. CCI involves a structural instability at the base of the skull where it connects to the upper cervical spine. And for those experiencing it, the impact on daily life can be profound and at times debilitating. In this presentation, I'll cover what CCI is, how it affects patients, and the various diagnostic and treatment options available, including some of the latest advancements. What is CCI? Let's start with the basics. Craniocervical instability is a condition where the ligaments and the connective tissue that supports the connection between the skull and the upper cervical spine become loose or weakened. This area includes the atlanto-occipital joint and the atlantoaxial joint. These critical junctions where the skull meets the top of the spine. And in a healthy state, these ligaments, such as the transverse and alar ligaments, hold the skull and the upper spine firmly in place, allowing for both stability and flexibility. However, when these ligaments become weakened or damaged, they can't provide the necessary support, allowing for excessive movement between the skull and the cervical spine. This can put undue pressure on the brainstem, on the spinal cord, and other nerves, blood vessels, and other tissues that are located in that area. What causes CCI? CCI can develop from various factors, including 1, trauma or injury, such as accidents like whiplash, or other types of trauma that can overstretch or tear these precious ligaments that support the craniocervical junction. Number 2, connective tissue disorders, like hypermobility syndrome or Ehlers-Danlos Syndrome, make ligaments more fragile and prone to stretching or tearing. Number 3, inflammatory diseases. Chronic inflammation, such as autoimmune conditions like rheumatoid arthritis, can weaken ligaments over time. Number 4, degenerative changes. Aging or degenerative spine conditions can also contribute to the breakdown of stability in the upper cervical spine. How does CCI affect patients? CCI can cause a wide variety of symptoms. Because of its impact on nerve function, blood flow, and structural support in the upper neck, there are lots of things that can occur. And here are some common symptoms. Neck pain and feeling instability. Many patients describe feeling like their neck can't properly support their head, or a sensation of heaviness in the head or bobblehead. Headaches and migraines. Tension at the base of the skull can lead to severe headaches and migraines. Dizziness and vertigo. Since CCI can affect the brainstem, it often disrupts balance and spatial orientation. Visual and cognitive disturbances. Blurred vision, double vision, and cognitive issues such as brain fog and concentration difficulties can arise. Neuropathic pain. Nerve compression in this area can cause radiating pain, numbness, or tingling in the face, neck, shoulders, arms, and hands. Autonomic dysfunction. CCI can impact the autonomic nervous system, leading to irregular heart rate, blood pressure fluctuations, digestion, or breathing issues, and more. Digestive function. Some patients experiencing digestive issues such as nausea and pelvic floor problems due to disruptions in the autonomic nervous system. Diagnosing CCI. Diagnosing CCI can be complex and typically involves a combination of advanced imaging and clinical evaluation. Here are some of the key diagnostic tools. Dynamic imaging. Standard MRIs may not capture instability since it's often static or positional. For this reason, dynamic motion X-ray or upright MRIs can provide a better view of the cervical spine in motion, showing any abnormal movement that occurs when the neck is flexed or extended or tilted. Digital motion X-ray. This imaging technique is particularly useful as it allows to observe movement in real time, capturing instability that may not show up on a static image. DMX can help visualize how vertebrae move relative to one another. Neurologic and physical evaluation. Comprehensive examination by a knowledgeable physician is essential to identify specific symptoms and rule out other potential causes. Flexion extension X-rays. This imaging method also helps detect excessive movement between the vertebrae in different head and neck positions, providing additional data on the stability of the cervical spine. Now let's talk about conservative treatment options for CCI. Once diagnosed, there are various conservative treatment options to manage CCI symptoms and improve stability. Here's an overview of some commonly used approaches. Number 1, upper cervical chiropractic therapy. Specialized chiropractors trained in upper cervical adjustments can help improve alignment without placing undue strain on the unstable areas. These gentle adjustments can reduce pressure on the brainstem and alleviate some CCI symptoms. Physical therapy and rehabilitation. Physical therapy tailored to CCI focuses on strengthening the muscles around the neck, which provide additional support and stability to the cervical spine. Working with a therapist experienced in CCI is important to avoid exercises that might worsen instability. Cervical bracing. Temporary bracing with a cervical collar can provide additional stability and reduce excessive movement, giving the ligaments time to heal and your body time to rest. But be careful, don't overuse it, and always do some rehabilitation in combination with this brace. Metabolic and hormonal optimization. Optimizing metabolic health and hormonal levels through functional medicine approaches can support ligament health and reduce overall inflammation. For example, sufficient levels of protein, vitamin D, and hormone balances play an essential role in connective tissue integrity and healing capacity. Pain management. Medications to control pain and reduce inflammation can improve quality of life, but they should be part of a comprehensive plan that addresses the underlying instability rather than just masking symptoms. For patients who need more than conservative measures, there are interventional treatments available. Prolotherapy and PRP injections. Injection-based therapies like prolotherapy and platelet-rich plasma aim to strengthen the weakened ligaments by stimulating the body's natural healing response. By injecting PRP directly into damaged ligaments, we can encourage tissue repair and provide some stability to the cervical spine. Stem cell therapy. In cases where ligament damage is severe, stem cell therapy can be considered. Stem cells have the potential to regenerate ligament tissue, although this area of treatment is still evolving. Upper cervical injections for nerve relief. Targeted injections near the occipital nerves can provide pain relief, helping to manage migraines and headaches that often accompany CCI. Surgical options for CCI. In severe cases where treatments have not been effective, surgery may be considered, though this is generally seen as a last resort. Cervical fusion surgery is sometimes performed to fuse the unstable vertebra, reducing this excessive movement. However, it's a complex surgery with significant risks, and it requires careful consideration and consultation with an experienced spine surgeon. Living with CCI. Living with CCI often means making certain lifestyle adjustments to manage symptoms and avoid exacerbating instability. Here are some self-care strategies that can help. Limiting certain movements. Avoid sudden or extreme neck movements that could increase stress on the cervical ligaments. Maintaining good posture. Proper posture, especially with neck support, can help reduce strain on the upper cervical spine. Using supportive pillows. Special neck pillows designed to support the cervical spine while sleeping can alleviate symptoms. Consistent self-care and monitoring. Daily attention to your body's needs, including rest, hydration, and gentle movement, is essential for managing CCI. Additionally, integrating metabolic and hormonal support can improve the body's resilience to stress and support connective tissue health over time. Some final thoughts on craniocervical instability. In summary, craniocervical instability is a condition that disrupts the crucial stability at the base of the skull, leading to a range of challenging symptoms. These symptoms can impact daily life significantly, affecting physical function, cognitive clarity, and quality of life. However, a comprehensive approach that includes advanced imaging, conservative therapies, interventional treatments, and lifestyle adjustments, many can find relief and regain some stability. If you or someone you know is experiencing symptoms of CCI, know that there are options available. I'm here to discuss your specific case, answer any questions, and work with you to develop a personalized treatment plan that addresses the root of the problem and helps you live more comfortably.